All right, let me begin. I want to welcome everybody to the ISSUP South Africa webinar, 22nd of May 2024. We are happy that you've all decided to join us, and welcome to the webinar on oral health and substance use. Just to begin, a disclaimer: webinars and online events delivered and hosted by the International Society of Substance Use Professionals, otherwise known as ISSUP, are provided for informational purposes only. They are educational in nature and do not constitute medical advice, diagnosis, or treatment. The views expressed by speakers or other third parties are those of the speaker or third party and not necessarily those of ISSUP. So welcome everybody. As I have said before, this is the webinar on oral health and substance use. Before I hand over and introduce to our guest speaker today, just a couple of housekeeping points. Please feel free to post any questions that you might have during the webinar in your question box that you will see in the control panel that should be on the right of your screen. We will have a chance to answer some of these questions towards the end of the webinar. We are looking at about 60 minutes today. It should be very, very interesting. So please feel free to post those questions. We will try and get to as many as possible. So part of ISSUP webinar, ISSUP South Africa's long-term plan is to look at a more inclusive treatment of substance use disorder in South Africa and around the world. And this means including professions that were otherwise not necessarily included in previous or historic treatments for substance use disorder. And one of the areas that we wanted to focus on was oral health and how this impacts on how substance use impacts on oral health, and also how oral health can also have an impact on the recovery after the initial treatment of substance use disorder. And with this in mind, I want to introduce our esteemed guest, Professor Dirk Smit. Professor Smit is a dentist and a specialist in community dentistry at the Faculty of Dentistry at the University of the Western Cape in South Africa. He is the chair of the Department of Community Dentistry since January 2020 and has 15 years experience as a lecturer after proven research and mentorship for under and postgraduate students in an academic and clinical environment. His other qualifications include certificates in Clinical Epidemiology, Biostatistics, Health Management, and in Medical Ethics and Law. He is an honorary secretary of the South African Dental Association in the Western Cape, an executive member of the World Health Organization Collaborating Center for South Africa, and serves on the Biomedical Research Ethics Committee for the University of Western Cape. He's currently completing his PhD thesis titled Oral Health Related Quality of Life, Dental Status and Treatment Needs of People with Substance Use Disorder. So we are so happy that you have agreed to share some of your wisdom with us, Prof. Smit. We really look forward to what you have to share with us, and I'm going to hand over to you. Thank you so much.
Thank you, Roger. It's a big honor and privilege to present today at a forum who probably does not include any other dentists. So yeah, this will probably be the first time in a few years that I've been presenting at this kind of platform, but I'm looking forward to engagement. And as most of the audience probably know, we will focus today on the basics of oral health and oral health related quality of life. And I think the reason for that was just to lay the foundation in terms of the importance of oral health and why colleagues need to consider the role that this part of the body, sometimes we forget that the mouth is part of the body, play in general well-being. So I will try to introduce you to the field of dentistry. I will focus on dental caries specifically, and I will share my screen now. I just wanted to also just share some, I think, some broad overview of where I'm coming from. I almost had a heartbeat missing when I was introduced as the chair of the government with the local elections. I'm not aware of any parties that's registered in my name, but anyway, it's indeed very interesting times that are lying ahead for our country. So I'm sharing my screen now. You can just say, Roger, you can just give me the green light if I can go ahead.
Please go ahead, we can see.
Okay, so thank you for this introduction. I've been at UWC for the past 15 years, and I've been working in different departments, reaching from pediatric dentistry, oral medicine, and then also lately I was working in maxillofacial surgery until 2017, until I joined the Department of Community Dentistry full time. So I've been around in the different disciplines of dentistry, and my journey with substance abuse started basically when I started working at the faculty. So I'm very passionate about this field. I've done my master's thesis on methamphetamine abuse and oral health. And as Roger said, I'm hoping and praying that I will hand in October my PhD thesis, which covers all the groups, and then also adding other components of the importance of oral health into the investigation. So this first lecture, this is the UWC campus. For some of you that don't know, it's based in Cape Town, South Africa. This is the Great Hall, the Jakes Gerwel Hall. It's a previous rector that we had. And this is the picture of our dental mobile clinic that we received about 2 years ago. So this is a very, very efficient clinic, and we have 3 surgeries in this clinic. The outline of this particular lecture will cover the importance of oral health, and this will include not only teeth, but it will also include gums or the soft tissue. I'd rather just say the soft tissue. So I think today's lecture is also just to share the bigger picture of the oral health field, and maybe also just to try to introduce to colleagues who are not familiar with the terms and specifically the epidemiology of oral health disease, the importance thereof, and how this could influence on our patients' ability to be treated for substance abuse. So tomorrow we will definitely focus on the effects of the different drug groups on substance abuse, but today's lecture is on the importance of oral health. I will also share some basics on dental caries with regards to the process, risk factors, some research that was done on all the different factors that play a role with regards to the process of tooth decay. I will also try to keep the term simple. So excuse me if some of the words does not make sense, and you are welcome to unmute and just ask me a question or verify something. Then I will also talk about diet, because it's a very, very important part of maintaining good oral health, and then oral health promotion and preventing disease. What can we do? What should we do as individuals, but also what can we offer our patients when they're in treatment to maintain good oral health? And then I will just briefly refer to oral health related quality of life. So this is an indicator that we use, an instrument that we use to determine the impact, oral health impact on well-being. So okay. So the first question is probably the most important: is why should we even maintain good oral health? So good oral health is important to prevent tooth decay and gum disease. So dental caries or tooth decay is the most common disease among all oral health diseases, and it's to prevent it in the first place. It's also important to maintain overall health. So poor oral health can lead to or exacerbate systemic conditions as heart disease, diabetes. There's a strong association between periodontal disease and diabetes, and it could also lead to other complications. It's important to preserve teeth structure, and this is not only to be disease-free, but also to be able to smile. We all have those big occasions, those big days, weddings and birthdays or job interview, where we want a nice, good-looking smile. And if you maintain good oral health, this is one of the benefits, big benefits that you can get from maintaining it, having a good appearance. It also prevents bad breath. So regular cleaning of the mouth can also help prevent halitosis or bad breath. So the importance of brushing and flossing is very important. Is quite important to mention here. The aesthetics and the social benefit, I think this is where it comes into play with regards to healthy teeth contribute to a confident smile. When we have patients in our treatment centers, having confidence is so important as a journey to recovery, and people sometimes underestimate the benefit of a nice smile or a healthy smile. Functional benefits refer to things such as speech, pronouncing words properly, just the ability to speak, also the ability to eat, and I think referring to chewing your food properly. And I will also allude to this under nutrition. And then the economic benefits, the preventative care and maintenance can reduce the need for expensive dental treatment. So if we can think of the least expensive way to maintain good oral health is not by going to a dentist every 2 months. It's not by having all these fancy fillings and prosthesis and so on for your teeth. It's brushing teeth every day twice, and that is very cheap to cover and to follow. And then obviously also your diet. And I will come to nutrition now. Then being pain-free and being free of discomfort. Good oral health practice can help to avoid painful dental issues like toothaches and infection. It will give you the ability to sleep better, to be able to give attention, and not to miss work or school. So this is a massive problem, especially among our younger community, our younger patients. They miss school because of toothache or pain and infection, and then subsequently their parents also lose out on work. The second last one is on nutrition, and this is where healthy teeth is important and essential for chewing and being able to really enjoy your meal. It's also important to mention here the ability to taste your food. As I said, oral health does not only include teeth, it also includes soft tissue, and I will also cover that a bit later. The last one is about mental benefit. So you feel better, you have less stress, and you're just overall more confident. So oral disease is quite prevalent, and these are just some pictures of people with poor teeth for various reasons. And I will just briefly mention the effect of tooth decay and why it's important to mention here. So dental caries is very common. It's probably among the most common diseases amongst children. It's among the majority of the population. It's the most common oral disease, and it's one of the most common preventable childhood diseases. It leads to absenteeism from school and work, as I mentioned already. It's one of the leading causes of child hospitalizations. And it's the primary cause of oral pain and tooth loss. Now, the process of dental caries, I will refer to that to the disease a bit into detail later, but it can be arrested and reversed in its early stages by the introduction of fluoride and good habits, and following a healthy diet, and the application of professional fluoride. But it also indeed leads to a decrease in quality of life, which per se also have an effect on your psychology. So fortunately, when you consider that previous picture of all those people with rotten teeth, there's also many of us that have a good smile, and we should be proud of that. So the following is the basics of tooth anatomy, the components of oral health, and I would like to apologize if this is maybe too low from a educational level. Maybe you will remember this from school or from early days at varsity if you've done anatomy. But we have the enamel layer on the outside, and then dentin and pulp in the inside, containing the blood vessels and the nerve structure. And then we also know that there's soft tissue with the gingiva, and the outer layer of the root surface also that has cementum, which is extremely hard. And then alveolar bone is the bone that the way the tooth is embedded in. And then with a diseased tooth, as you can see, the infection will start from the top frequently. It will expand into the dentin, which is the inner side of the tooth, and then into the pulp, and that infection will spread through the pulp down the canals, and then it can also lead to a periapical abscess or infection. In these cases, there's usually two options of treatment, and that is either removing the tooth or doing a root canal. In some cases, due to this infection around, you also need a surgical procedure called the apexectomy, by removing this piece of bone and then drain that area and fill it with a medicament. Just quickly, the difference between primary and secondary teeth. So in the primary dentition, we have 20 teeth, and they have different eruption times, as you can see. The earlier central incisors, the lower central incisors erupt around 6 to 10 months. And then on the right-hand side, it's the permanent dentition with the eruption times on this side. So you basically are in a mixed dentition for a big chunk of your youth, and then until your third molars have erupted around 21 is when the last two teeth actually erupted. During all those years, there are also times of where teeth exfoliate, and there's a lot of movements and changes happening, especially when considering premature dental extractions, and then also the space complications that normally follow with that. This is just the shapes of the roots, and just to show you that not all the teeth have one single root. So just for the field of oral surgery, sometimes also it's important to explain to people who are not dentists or oral hygienists that the anatomy of the teeth are different, of all the teeth are different, and that's also why we have specific techniques and instruments to remove different teeth. It's not only one plier that you can use for upper and lower teeth. So every quadrant almost in the mouth, or let me rather say every sextant in the mouth almost need a different forceps. Okay, so when we look at the basics of oral soft tissue, we can just refer to the gums or the gingiva, the tongue, the lips, cheek, the inside of the cheeks, which we call the buccal mucosa, and then the area behind the wisdom teeth is the retromolar fossa, or the trigone. And then we have the palate, which is divided into the hard and the soft palate, and also the sulcus, the buccal mucosa with the buccal sulcus also on the side. So I think the importance of this is just that besides infection and disease that can occur on the hard tissue, and also trauma, I think people so it's so easily to forget about trauma on the hard tissue, especially considering the strong association between trauma and substance abuse, especially alcohol abuse. So the soft tissue is a part of the oral health which is very important, because this is where we see the manifestation of diseases, infections, viruses, and certain common diseases present on specific areas in the mouth. So, for instance, oral cancer, squamous cell carcinoma, it's very common on the floor of the mouth. HIV presents very commonly on the lateral borders of the tongue, and then also you have different fungal infections that you often see on the buccal mucosa or on the dorsal area, the ventral and the dorsal area of the tongue, and then also on the hot palate. So from an oral health diagnosis and pathology point of view, it's quite important also to know about the soft tissue. And I think it's just important to know that there's an important role also playing. So this is just a picture of some healthy gingiva and tongue. So I didn't want to gross you out with some bad. This is probably some of the worst pictures that I will show today. This is just some pictures of oral ulcers, which have classical locations in the different components of the mouth, and it just makes us easier to provide a differential diagnosis before biopsy is done. Periodontal disease is a condition which is characterized by infected gum line or gingiva. As you can see on the left side is reasonably healthy gums. I wouldn't say it's perfectly healthy gums. There's already indication here of a little bit of inflammation here, but you can see typically periodontitis and gingivitis is characterized by a deeper red color, rolled borders. There's sometimes not a classical knife edge appearance of the interdental papilla. And then in this advanced stage of periodontitis, you will see loss of attachment, calculus and plaque accumulation. Sometimes there's separation of pus, or there's signs of spontaneous bleeding. So you can just see the vast difference between that and the patient with healthy teeth and healthy soft tissue. Sorry, the quality is not that great. Same on this side. This is just a picture of the floor of the mouth. Nothing abnormal here. Just all healthy and normal structure. So the next part will be looking at dental caries or tooth decay. And I will also refer to an article that was published in the Lancet many years ago, but with very good references and explanations. So firstly, it's a localized destruction of susceptible dental hard tissue. It's mostly initiated by acid byproducts from bacterial fermentation. And it's very important here because the oral cavity is colonized with a whole spectrum of bacteria. The most important bacteria is the Streptococcus mutans, which is the big one that we need to remember. And then it is a multifactorial disease, meaning that there's a lot of elements involved in order to lead to a situation where you have cavitation of hard tissue. Remember, the enamel surface, which is the outer surface of the tooth, is extremely hard. It's much harder than bone. So in order to dissolve that, you really need something very, very strong and potent to lead to dental destruction. So as I said, it's multifactorial. It starts with microbiological shifts within the complex biofilm and is affected by salivary flow, which is a big problem amongst substance use patients. The composition thereof, is it tacky or is it a normal composition? Exposure to fluoride, as I said here, the most common exposure to fluoride is brushing teeth with fluoridated toothpaste twice a day. Consumption of dietary sugars, so sugar is a big problem here, and then also a lack of preventive behaviors, and also gauging how much brushing is done, how frequently dental visits are attended, and then also considering the diet, as I said. So this is just an illustration of all the different risk factors. So you have your sugar substrate or your sweets that's so common and highly preferred amongst substance use patients. Bacteria that's already in your mouth, and they release acid, and this leads to a lower oral health pH. And I will go a bit later into detail. So I think the main article that I would really encourage you to have a look at if you want to understand more about dental caries is an article about salvage by Salvage, Ishmael and Pitts, Nigel Pitts. They published this in 2007 in the Lancet, and it provides a very insightful perspective on the definition, pathogenesis, risk factors, and epidemiology, diagnosis, and treatment of dental caries. It also speaks about preventing dental caries in the first place. If I can share something about the pathogenesis, it's a result of interaction of over time between acid producing bacteria, as I said, Streptococcus mutans, the substrate, and many host factors, including teeth and saliva. It then results from an ecological imbalance. So if this imbalance in the mouth leans towards a pH level which is lower than 5.5, this is where demineralization then of hard tooth structure occurs. And then this interchanging process, as I said, is shifting from pendulum to pendulum, and is a shifting pendulum, and it's very dependent on the balance between demineralization and remineralization. So in the saliva there are minerals, and the saliva itself is also buffering benefit of that prevents demineralization. If your saliva is either inadequate in terms of composition, or where the flow is compromised because of using methamphetamine, for instance, then you lose this neutral buffering capacity to to help prevent against demineralization. So the cavities then will develop, and the oral biofilms will become more mature and remain on specific sites. There's a lot of research also done on where demineralization mostly occur. It's often on the flat surfaces of teeth or the interproximal surfaces. So the interproximal surfaces is between the teeth, which is very difficult to reach with an ordinary toothbrush. And then over time, this cavity becomes an ecological niche area, and the plaque organism gradually adapt to a more reduced pH, just making things even worse. If we look at the risk factors, and this is the illustration from Salvage article, it's adapted from the Feierskopf and Manji in 1990. It refers to the physical and biological risk factors, which is very important for enamel or root caries. It includes inadequate salivary flow and composition, high numbers of carcinogenic bacteria, as I mentioned already, present in the mouth, Insufficient fluoride exposure. So this is when you have a person who brushes once a day or less than once a day. I would like to refer to that as infrequent brushing compared to a person brushing twice a day or more often as frequent brushing. Then further on, risk factors include immunological components, need for special healthcare. So these will be patients with special healthcare needs, and some genetic factors. Related to one's lifestyle and behavior is considering it includes a person's control are clearly implicated with these factors. These factors include things like poor oral hygiene, poor dietary habits, frequent consumption of refined carbohydrates, frequent use of oral medication that contain sugar. I think these days that one has been addressed to some extent, but I think there might be still many syrups and so on that contain high levels of sugar. Other factors related to caries risk include poverty, deprivation, social status. So we also know that people from a lower socioeconomic background have less access to oral health delivery platforms, and also less access to something as simple as a toothpaste or running water. Dental insurance coverage. In South Africa, we have a massive problem with access to basic oral health care, and I will show a bit later in this presentation also research that I've done on that specific topic in the Western Cape. The use of dental sealants. We know that fissure sealants applied on the first molars have a very beneficial effect, but again, it boils down to access to dental care. This can only be applied by a professional such as a dentist, an oral hygienist, or a dental therapist. And then also application of orthodontic appliances or poorly fitted partial dents is also a problem. And something that I can mention here is that considering that about 90% of the population does not have a medical aid, most of them are reliable on state clinics. I can speak for the Western Cape, and in the Western Cape in South Africa, oral at the clinics, no dentures are constructed except for the tertiary centers such as Tygerberg Oral Health Center and Mitchells Plain Oral Health Center, which is in Cape Town. But with regards to all the other clinics in the province, dentures are not constructed. It's not part of the basic oral health care package. And this is a huge problem, which leads to many of these patients ending up at a person who is you can call it an informal denture maker. And there is not much research on this specific topic, and there's not really figures available. But when you speak to patients in the state sector, or when we do outreach, dental outreaches in the community, and even also just considering the patient interviews that I had with my PhD and with my master's, many of these patients go to a person who operates in a garage or in his kitchen, and they make dentures. It's far less expensive, and it's available. So it's a huge problem, and yeah, it's really for the patient. It's also a catch-22 because they have premature tooth loss, and now they really need something. So it's a very difficult situation to be in. Right, let's move on. And then this is just a diagram showing the different phases of tooth decay. So initially you will see for white spots on the enamel when it's the early stages. At this stage, it's still reversible by application of strong fluoride. Even with sufficient cleaning by a toothbrush and remaining in good diet, it's reversible. The moment it is a bit deeper into enamel, this is usually when a restoration is indicated, similar to this one in the dentine. And then the moment it it penetrates into the pulp. Root canal therapy or endodontics is required, or else the tooth needs to be extracted. That's usually the case when patients present at this level. This is just to show dental filling. Sorry for the quality again, very poor. It's just to show how it can be done. The early phases, the different phases of early childhood caries, I just wanted to show because it's a massive problem. Most of us, some of us do have our own children also, and I think also just speaking to an audience that might not be dentists, I think it's important just to mention the fact that primary teeth is as important as a secondary teeth or permanent teeth. For all the reasons why permanent teeth is important, but also considering the space that the primary teeth holds for those permanent teeth when they come. So the normal healthy primary dentition is a bit more spacious than the permanent one. As I said, the primary dentition includes 20 teeth, and then when it's early stages of early childhood caries, we can see these chalky white spots or patches, normally on the cemento enamel junction or the area around the gingiva. And then the brown spots, these chalky white become more brown at a later stage. And then with severe stages of ECC, there's complete coronal destruction. And in these cases, the patients need dental clearance or multiple extractions. I think the challenge here is that when we see these patients at a very early age, such as 2 or 3 or 4, it's very difficult to get compliance from a 3-year-old extracting 10 teeth. So in those cases, they will need hospitalization to perform these procedures under general anesthetic. And as I said, the most patients are state patients, and these waiting lists can be quite lengthy. So another big problem. Some common causes of dental caries: getting the bottle at night filled with sugar, drinking tea or juice. Tea containing a lot of sugar is very common amongst people, and then especially amongst the patients that we see at the oral health center. And then some people also have this habit of dipping the dummy or the in honey or in sugar just as a soother. So it's a very bad habit, and it has very bad consequences. For adults, infrequent brushing and flossing. I think that was covered already. So I just wanted to show a bit more pictures of dental caries in different stages. The idea is not to gross you out or to lead to nightmares tonight, but this is what we see. And I think the other thing of dentistry is that patients frequently come at a very late stage. They don't come early when they feel some sensitivity. They come to the clinic when they have severe pain, and that's also a problem per se. So other complications also from childhood caries, early childhood caries, is severe toothache, infections, poor eating, poor sleeping, fever, ear infections, speech problems, and poor appearance. And as I said, all of these lead to missing school days and subsequently also missing work days. So in a nutshell, the most important to prevent dental caries is to introduce the oral cavity to fluoride, and the most important, and I think the least expensive way to do this is to brush every day, twice, with a fluoridated toothpaste. And I think the message here is that the brushing needs to happen. Some people have sensitive teeth, and they would consider a specialized product, which might be a bit more expensive. But the first question should be, are you brushing teeth twice a day? And your most common brands of toothpaste that you can get in the local supermarket, with a fluoride content of about 1,000 to 1,500 parts per million in fluoride content is sufficient. The most trusted brands also have specific labels for sensitive teeth or for gum disease, but I think as a starting point, brushing needs to happen twice a day, and this includes brushing your child's teeth from the first tooth erupt. There's different types of brushes that one can consider for the non-dentate child, infant before 6 months, and we know also from research is that oral microorganisms can actually colonize and also is present in even the edentulous patients. So being edentulous does not mean no more brushing. It means that brushing is still required, especially of the ridges, the gums, and the soft tissue around. And then I think one part that I didn't include in my presentation was also maintaining good hygiene with your dentures. So the patient that already has dentures, those dentures need to come out in the evenings when the patient goes to bed, and there are different solutions available in pharmacies that can be used for dentures. Otherwise, the denture can be left in a glass of water at least. But important is to brush the gums and the tongue with toothpaste, and then the denture also need to be cleaned. Now again, there is chemicals available at the supermarkets and at pharmacies for cleaning of prosthesis, dental prosthesis. But I also know that the most of our patients don't have those funds to buy that. So in that case, I will ask them, how do you clean your denture if you do? And in most cases, they are cleaning it with normal toothpaste, which I feel is quite abrasive. So I then propose that they rather use some dishwashing liquid and then rinse it afterwards, at least. So it's less abrasive than something like toothpaste. But if the patient's diet also consume a lot of include a lot of coffee and smoking and so on, it's sometimes difficult to remove. Then now and then using toothpaste should be okay. Okay, so I've mentioned the importance of brushing already, and flossing is the other thing that I didn't mention. So a daily flossing is advisable. It is a new habit if you are not used to it, but once you get the hang of it, it's fairly easy and quickly to floss your teeth. But as I said, a common area of tooth decay is those interproximal areas, or the teeth, or the areas between the teeth, which is very difficult to reach with a normal brush. So that's why flossing is so important. If you don't clean those areas, it can also lead to odors or halitosis or bad breath. So flossing is as important as brushing your teeth. Getting a good mouth rinse is also a big advantage, but again, it comes with a cost, and many of our patients don't have the necessary means to afford it. So what I usually propose to them is to consume lots of water, and then rinse your mouth just with water, then after every meal at least. It will also help to remove food stuffs, and it will also assist with neutralizing the pH in the mouth, and I will speak about the importance of that tomorrow with regards to the common dry mouth that patients report on and how to address that. For children, it's important to supervise them. A child I would say that a child up to the age of 10 years old should be supervised at least for one of the 2 brushings per day. And I think from a parent's perspective, you need to also check in the mouth and check their sequence. Without being too technical, I think the most important with regards to brushing is that all the areas should be covered. So there are different songs that one can play to a child or sing with a child when they are brushing. But the most important is that all the areas, all the surfaces are covered. So it's always advisable that you brush in a sequence and that you have a system. So I will start, for instance, in the right top corner, and then I will work my way around, brushing the teeth of my child and of my patients, the younger patients, and then ensure that the occlusal surfaces or the chewing surfaces are cleaned all the way in all 4 quadrants, and then also ensure to include the palatal surfaces or the areas that are the top teeth showing to the palate. That's the palatal area, and then also the buccal areas, the front part of the tooth showing towards the lips. So that's why it's important to ensure to cover everything. If you notice that a child or a patient, even an adult, is just quickly brushing and you can see clearly there's no pattern, there's no sequence, 80% of the tooth surfaces was left out, you need to address that. So it's something as basic as that can make a big difference. Just a picture of supervised brushing. It's also important to mention that brushing, specifically in a low socioeconomic community, needs to happen at the school setting. This is a bit of a challenge also because our educators are not always at a level or receptible to do this or to supervise toothbrushing at schools because they have so many other things to do. But it's a very nice area to intervene and to introduce toothbrushes. There's lots of good programs around South Africa and globally from Colgate Palm Olive. It's called Bright Smiles, Bright Futures, specifically for lower socioeconomic class schools. And then they provide toothbrushes and toothpaste for those schools when a dentist or oral hygienist can propose it. And I think one should consider, similar avenues also for the patient that is currently admitted into a substance use program. And I know many of our centers do provide them with toothbrushes and toothpaste, but I think start at the basics, brushing twice a day, ensuring that all the areas are covered. Using a fluoridated toothpaste cannot be emphasized enough. It's the fluoride in the toothpaste that actually prevent dental caries in the first place. Just something about the amount of toothbrush. So you will probably think this is not enough, but the point that I want to make here is that when you have a child of 1 to 3 years old, you can only apply a smear. Now, this is a very small blob, or let me say this is a very, very small droplet. But a smear is literally just a smear. It's not a substantial amount of toothpaste. And in the next slide, you will also see that there's a difference here between a normal application of toothpaste, which is very common for adults, and then a pea size for children. So what I would like to propose is that you also check on the box of toothpaste. There's usually directions for use, and for instance, children of 1 to 3 years old or 0 to 2 years old need like a pea size or just a smear. It depends also on the fluoride content. While the child of more than 2 years or more than 3 years need a pea size. So I think the point that I want to make is when you buy a toothpaste for your child, check the labeling. Normally our specific toothpaste for children have a lesser fluoride content of about 700 parts per million. But in general, if the patient does not have access to that, a young patient, then the normal toothpaste can be used, but then in very, very low quantities, to reduce the risk of swallowing. Obviously, we know that our younger children are not able to rinse and spit out. They will easily swallow, and then it's fine, but then the application must be very, very minimal. When we speak about diet, it's very important here to decrease sugar intake, as I said, and referred earlier, the important factor that sugar play, and promotion of healthy eating, and then also promoting healthy snacking. So we all need strong, healthy teeth to chew and to speak and to smile, and this is nutrition not only needed for our general bodily function, but it's also to maintain good oral health. It's also important for a child's growth and development, and almost all foods include milk and all vegetables, including milk and vegetables, have some type of sugar. So I think this is why it's so important also to consult a pediatrician or a pediatric dentist or a nurse, especially with regards to feeding practices. It's always advisable not to include any sugar in your milk or in your tea with the bottle. Rather just use it as it is. But even, I think the point that I want to make is, even if you only feed milk, there's also the importance of brushing twice a day. Okay, we've spoken about the amount of sugar, and then read the food labels and choose foods and beverages that are low in added sugars. Now, I know that this is not always possible. You might have a patient that buy food where there's maybe not even a label available, or they are illiterate where they can't read. So I'm really trying to accommodate a lecture here for professionals, highly educated people, and also just sharing things that might be applicable on the patient who didn't even finish school and now is admitted into a treatment program. This is a big one. Encourage drinking water. It's very common that patients consume large amounts of sugary soft drinks. Your cheapest soft drinks on the market is usually the first thing that they consume in liters per day, and no water. So a big encouragement is for them to drink water, and to drink lots of it. It will act as a natural neutralizer to the oral health pH. It will also assist them with metabolism, and it contributes to good nutrition. Okay, so balanced diet should include fruit and vegetables, grains, dairy products, and then different protein choices, and seafood. And I think the importance of in-between snacking is relevant here. For instance, when they are in when patients, substance use patients, are in a treatment program, it's important to consider those tuck shops at these centers and see what products are available there, but also in general as part of the educational platform for the patients, to explain to them the importance of a balanced diet, to explain to them of the effects of a high sugar intake, and then also explain as how in between snacking is okay, but then when it's done, try to avoid sugar, avoid chocolates and sweets, which is very common amongst patients, and then rather to have more healthy fruit available. It's also frequently less expensive also to get an apple compared to a chocolate bar. Diet analysis for patients is a slide here that I want to just try to propose to colleagues in the field of substance abuse treatment. It's important to consider the types, frequency, and quantity of food and liquids intake. So in my PhD study, I was looking at liquids, both non-alcoholic and alcoholic intake, in terms of the type of liquids that was liquids and solids that was consumed, and then the frequency and the quantity. So I'm not sure to which extent diet analysis is considered in a normal standardized program, but I think this is an important thing that needs to be considered, specifically considering oral health and addressing the effects of substance abuse and a poor diet on oral health. The other thing that one can also look at is the appetite. So in my study, I was also looking at appetite that the patients experienced during their primary drug or secondary drug, and then also I was looking at in between snacks, whether they had breakfast, lunch, or supper. So I know in most of our inpatient facilities there is a slot for breakfast, lunch, and supper, but this might be a bit different to our outpatient facilities, where a patient basically will not eat at the center where they receive treatment. So I think these things are also important to consider. And then in that breath, I think it's a good idea also to consult and to consider dietitians also having an input as a diet counselor for these patients. Another thing that I think is frequently overlooked is the number of teaspoons that our patients consume. So in my PhD study, patients will also consume more than 1 cup of coffee or tea per day, and then it's not frowned upon when a patient report having 3 or 4 teaspoons in each cup. So so with all the different cups of coffees that the patient will consume, there's added sugar. There's added sugar again when the patient have breakfast in the morning. So all of these add up, and in my thesis that I will hopefully submit later this year, I will try to analyze that according to the different groups, and also try to show where the different components are in the diet where large amounts of sugar is introduced. About dental checkups, I think I just want to share here some research that was done a few years ago on basic oral health care in the Western Cape, where my study was on. So I was looking at the availability of the basic oral health care package in the Western Cape province, and the basic package, the basic treatment package that we are offering in South Africa in state clinics include things like oral examination, like a checkup, very basic 1 to 3 surface fillings, scale and polish or a cleaning, very basic x-rays. We call it a bite wing x-rays, which is, you need an x-ray unit for that, but it's not even the big complicated Panorex x-ray. And then the last one is dental extraction. So it's fairly basic services that you need. And from the research that I've done, by including all the clinics in the province, the most clinics, or let me rather say the half of the clinics in the metro was the city of Cape Town, could offer this package, while the most clinics in the rural areas could not offer this package. Indeed, only 25% in the rural clinics. Those are all the districts outside the city of Cape Town. Among all those clinics, only 25% of them could offer this package. And 65% of all the clinics in the province could only do extractions. So that is basically it. And I hope that from this presentation so far, you could see that oral health does not only involve teeth, firstly, and oral health services does not only involve extractions. I think there's a misconception that dentistry should only involve teeth and dentistry or oral health. Dental care should only be extractions and nothing else. And I think that's the point that I want to make here. Yeah, the ratio of dentists to population is also very, very bad. But yeah, the problem that we have in South Africa is not by appointing more dentists. We will need to focus on a very, very low level in the school setting or even preschool setting to introduce better healthcare. This is just a slide on the consequence of dental extractions. So it does have an effect on your chewing ability. It has an effect on your appearance, and not being able to chew and not being able to smile for someone or smile at someone, or being able to go to that work interview. It has a psychological effect. The intraoral effects include having gum disease or pain, and then the for systematic diseases. So we know there's a strong association between gum disease or periodontal health, periodontal disease, and diabetes. Protection. Okay, so the importance of a mouth guard is important here, especially for sport that involve contact. Then the last part of this presentation will just be briefly touching on oral health related quality of life. So in our field, we have an instrument called the Oral Health Impact Profile, or the OIP 14, which we use. And this instrument is very important because it tells us something about the impact that oral health has on the patient's well-being. So this instrument involves 14 questions that we ask to the patient, and each two of the questions speak to a specific dimension: functional limitation, physical pain, psychological discomfort, physical disability, psychological disability, social disability, and experience some form of handicap. And then the patients get asked to respond as never, hardly ever, occasionally, fairly often, or very often. And then there's also a score attached to each of these responses. So you can work out a mean score or average, and then you can have a better idea in terms of the impact of oral health or problems with oral health on the patient's well-being. So it was designed to measure quality of life. It was designed by Slade and Spencer, and can be applied in different settings. It has been applied in some settings that deals with substance abuse, and for my PhD, I've also applied it to my sample. And some of the reports that is available in the literature does indicate that patients do experience a poorer quality of life compared to the general population. Okay, then almost finished. The complications of a dry mouth, and I think the reason why I'm throwing this one in here is because it's so common amongst our patients that we treat in substance treatment centers. So it leads towards difficulty in food intake, speaking, and swallowing. In some cases, patients do experience unpleasant taste. It can also lead towards a burning mouth, which is sometimes called burning mouth syndrome. It can lead towards inflammatory conditions of the soft tissue, fungal infections, cheilitis and glossitis, which is also inflammatory responses, and other effects. Such as dental erosion, tooth fracturing due to caries or trauma. The take-home message is to remind everyone that teeth remains very important for health. Not only teeth, but also oral health in totality remains important for general health, learning, function, and to improve quality of life. In order to keep teeth healthy, a low sugar diet is required. This means eating healthy food, maintaining good balanced diet. Good oral health habits is very important. This includes brushing twice a day and regular dental checkups. And these considerations need to be taken when treating patients for substance use disorder. So on that note, I would like to thank you. I am done with my presentation. Roger, I hope I'm still on the call.
You are, yes. Thank you very much.
Can I unshare?
Yes, you can go ahead and unshare. Thanks. Okay. Thank you, Prof. Smit. What a fascinating presentation. I think we all got so caught up in what you were saying, and it's all stuff that we think we know, but hearing an expert talk about it, you realize how much of a gap there is between our knowledge and our practice, and it's always good to have that brought to our attention. But one of the things that you mentioned, I mean, you mentioned it several times, was how important oral care is in the recovery of substance use disorder. And I think that that is such a takeaway that we are looking at in terms of how it impacts on the long-term recovery for our patients and the people that we assist on a day-to-day basis. So, and I think that that's something that we're going to be looking at tomorrow, if I'm not mistaken. You're going to be talking about that tomorrow.
Yes, okay. Tomorrow I will try to go into detail about the different drug groups also. Some of them are a bit different, but I think that will only be available a bit later towards the year when my thesis is completely done. But I think it's important to have those discussions and learn from each other also.
Absolutely, thank you. Okay, so yes, to the audience, don't forget to join us tomorrow at the same time on the same link for the second part of this a webinar series, and that is looking at the effects of substance use on oral health. So, Prof. Smit, we do have a couple of questions. Do we have some time to answer one or two of these questions?
Yes, I hope we have some people, because on my side I can only see me and you, so I'm not sure if there are any other people.
I'm not going to tell you exactly how many people yet. I don't want to frighten you. Okay, so a number of the questions that were posed dealt with how can what you are talking to us about, how can we incorporate this into drug prevention programs? Yeah.
Now, that is an excellent question. I think one needs to consider the current program that you offer. In my research, we did have focus group discussions with some of the staff. And I think this is just a starting point to look at those areas where we can introduce a bit more to address all the different components that are presented and spoken about today. So I think it will in most cases, look, Roger, in most cases it's not introducing or to appoint a dentist at the center, at each center. Many of these things are basics, and you can use existing staff members to share knowledge and to share the things that I spoke about today. To consider your current program in totality, and then see where can one fit into the current program a bit more, that will, I think, that will promote good oral health. And I think more engagement is needed from the different communities. I know that in general there's not a dentist appointed at treatment centers. It's usually more auxiliary health staff, nursing staff, sometimes medical staff. So one needs to look at the entire team and program and then see where there's a possibility.
Absolutely, and that ties in a lot with what you mentioned during your presentation, and that was the diet analysis in treatment centers. And I'm not sure that that's something that treatment centers really consider in terms of how does that impact on the recovery of the patients itself. Yes, we want to get them up to a fighting weight once again, but to what point are we actually making a burden on their back rather than actually making it easier for them to continue their long-term recovery with a healthy nutrition.
Yeah, look, I think the other thing that I've missed out is also looking at the current workload of staff at the center. And I also know that currently there's a massive burden also on treatment centers with less subsidy that they get from government. And I think that's a serious concern and a serious challenge for many centers. So one needs to be careful to add extra work to staff members when they're already close to burnout. So I think the whole industry, I think not only for South Africa, but the whole industry needs to look at the overall program and also considering, and I think it might overlap a bit with what we will cover tomorrow, but what the patient need also to continue that that recovery journey. You know, just one thing that I can share now is that sometimes a patient experience so much pain, toothache or dental pain, that they cannot even sit with a counselor to speak about their triggers or speak about their environment where they live in. So you know, something as simple as going to an interview because they simply don't have confidence due to poor dental appearance. They don't have confidence even to go to the job interview. So those things I think are relevant, and it's worth to discuss those things because I believe very firmly that it does affect their ability to remain clean and healthy.
Absolutely, yes, thank you. And that's something I want to mention just before we close. But there was another question that I found quite interesting, and that was posed by someone from Impal, which I'm assuming is in India. Does prolonged use of substance use result in tooth decay or poor teeth, even when brushing is done twice a day?
Yeah, it's a good question. From my master's thesis, I did look at the duration of substance abuse and also brushing frequency, but I can't remember in detail now at the analysis. You know, if I can just share my general opinion is it will contribute to better oral health because the brushing is in place and it's happening frequently. I think in most cases during drug use, brushing is not happening frequently, and diet is also not appropriate and not ideal. So in most cases it does not happen. But I guess in the patient and in some patients I did see that brushing is happening frequently, and I think in those cases it will definitely, when it's measured and compared with those that are not brushing frequently, it will be better in terms of the dental status.
Absolutely, and I think, you know, I think the role that sugar plays is actually twofold, because what we find often in our treatment centers is that the cross addiction from illicit substances onto sugar is something that we have to deal with on a day-to-day basis, particularly in the treatment programs, and it's often something that is overlooked as being important, that we need to sort of also look at controlling that side of things. And I think that that's something that your presentation really brought to the forefront in terms of the gaps between what we are providing and what we are focusing on in our treatment programs.
Yeah, another thing that I'm also thinking of is smoking in general, smoking cigarettes. So smoking cigarettes is very common amongst substance users. You know, from some preliminary analysis that I've done in my PhD, it's quite interesting that the number of cigarettes smoked per day is different, significantly different among the the two groups who are brushing frequently and who are brushing infrequently. So what exactly that means, we're not sure, but we can see it from the data that the number of cigarettes being smoked per day is significantly less amongst those who brush more frequently. Now, thinking about that, I'm not entirely sure what the reason is, but I think cigarette smoking is also something that one needs to look at. I think it's as important as sugar intake also.
Very, very interesting. I mean, what you've just spoken about in terms of cigarettes and the link between brushing and the number of cigarettes, I think there's a unique research study there. So if anyone is considering their PhD who's listening to this, you have a topic there that is being handed to you quite easily. You don't have to think about that. I think that the last question I'm going to pose, which is very, very interesting from the treatment perspective, is because there's this push to the opiate substitution therapy, and that is the use of methadone as a maintenance program for opiate use. And the question was posed from an attendee from Kenya, and they ask, is there a relationship between oral methadone use and tooth decay?
Sure. Yeah, I remember vaguely reading about it in my literature review update. So I think I would rather take that question on email or so, and then I can go back to that article, because I did read something about it a few weeks ago, but I can't remember the exact finding. But that person is welcome to contact me.
Okay, great. Thank you. I think, you know, there were a number of other questions, but I am aware that, very acutely aware that we're running out of time. So I am going to, those who I haven't had a chance to pose the questions, I will see if it's possible for us to arrange a recording where I pose those questions to Prof. Smit, and we will then post those answers online when we do post the recording of the webinars. Just a reminder that all of our webinars are recorded and then posted onto our ISSUP YouTube channel. So please, if you would like to access that, please feel free to join the ISSUP YouTube channel. And then secondly, please remember to join us again tomorrow at the same time with the same link for the second part of this webinar series, where we delve more deeply into the effects of substance use on oral health. Prof. Smit, I want to thank you so much for your time today. I know that you are in between traveling to meetings and lecturing, so we are acutely aware of how valuable your time is. So we really do want to thank you for sharing your expertise with us. You really have sparked a unique discussion, and I think it really proves the point that it's so important for us as treatment and prevention experts in the field of substance use to focus on the multidisciplinary approach to the interventions of substance use, not just in treatment, but also in prevention. And how do we incorporate more people in different fields that have often been overlooked, such as dentistry. And we as ISSUP, we've also been working with the pharmaceutical side of things and looking at how do we incorporate them into substance use disorder interventions. So we really, really want to thank you for your time. It was extremely, extremely interesting, and we hope that we'll be able to access once your thesis is published. We would love to be able to share that with the rest of the world. Again, yeah, thank you once again.
Yeah, looking forward to tomorrow.
Absolutely, absolutely. Right. To all of our attendees, thank you so much for attending our session today. If you are not a member of the ISSUP network, please consider joining ISSUP as a member, and you will have access. You'll be able to access all of our international and national events, such as today's webinar, on a daily basis. There's always something happening from one of our chapters from around the world. So please consider joining our network. And we look forward to seeing you all again tomorrow, and we hope that you enjoyed today's session. Thank you so much. Have a great day further.